When I first heard the AI phone call, I didn't believe it wasn't a human being. There's no way. And one of the most challenging
No.
calls that if I were the patient talking, trying to get an appointment, I would have hung up on that, call because it was just too hard. Welcome to A Swift View on Health. My name is Wally Gome. I'm here with my business partner, Scott Shamevogel. And Scott, I don't know about you, but I am super excited about this episode where we're going to talk about innovations in artificial intelligence for healthcare. And, this is not going to be about sci-fi and what's going on in the future, but we're going to talk about right here, right now, what's happening in the real world. And our industry needs this right now. There's just so many challenges that technology can help solve for. And, when I think about, pressures on complexity, access, healthcare trend, and inflation, we need this right here, right now. What's your thoughts on that, Scott?
Yeah, at its core, I think healthcare, the industry itself, is probably the most administratively burdened industry in the entire world. And, as such, if you think about artificial intelligence and these AI tools, their ability to handle these administrative tasks is, I mean, Wally, I think it's probably unlimited at this point, like literally unlimited. And so the ability to bring that capability into an industry that is so desperately in need of a solution to become more efficient, I think the future and the opportunity is unlimited. I could not be more
I'll
excited.
tell you, when you think about complexity, I mean, we started an alternative health plan to deal with that, right? We called it Simple Pay Health and Coop Health. It was all around removing the administrative complexity, which, when you go back and look at studies like the Global Brand Simplicity Index, health insurance ranks dead last as the most complicated industry on the planet. And I think depending on the study you read, healthcare complexity adds somewhere between 30 to 40% of the cost of healthcare, to the expense line. So we can be better. We need it. We need it now. And ultimately, we need it to be able to improve clinical outcomes and to create better access. So, when you think about some of the innovations that are going on right now, one that I'm super excited about is how AI is helping brokers and consultants, plan sponsors, and their employees more easily navigate the complexities of health insurance. I mean, Scott, talk a little bit about, one of the solutions we've been evaluating and why that really can make a difference.
Yeah, I think one of uh, the easiest solutions for AI to tackle is really just around benefits and understanding your benefit plan, answering benefit questions. The books that we use, I call them books. I mean, they're literally 90 to 100 pages. I mean, technically, we might call them like a summary plan document or something of that nature. But can you imagine having to find your way through 100-page summary plan document to answer a question about whether or not your service is covered or what doctor you ought to use or how much you would expect to pay? Like that blows my mind. And to imagine that there's now technology that you and I know is actively working in the market, delivering incredible results where you just drop in those documents and all of a sudden there's just an easy interface. It's like, tell me what you're looking for, and you get an answer that I guess almost 30 years now of trying to manage concierge team that we could probably never have achieved, like blows my
I'll tell you,
mind.
in the real world, brokers are implementing this right now. They're getting client questions that maybe took them, hours to days to respond. Now they can, within a matter of minutes, send their client a detailed and thorough response. I've had many consultants say that what they're doing now for clients is actually better than the work they would do without that technology. It's resulted in a lot of clients saying, hey, can I have this on my desktop? I don't even have to send you the question. I can now be an expert in areas that I didn't have expertise before. And some have even pushed it down to their employees. So they don't have to pick up the phone and call 1-800 customer service, and they can get instant answers now. This is beginning to expand into health plans and I mean everywhere.
Yeah, and it's not just for your health benefits, right? Like you could load any HR policy or life insurance or other types of benefit solution into these platforms, and all of the complexity, all the challenge of just managing and knowing all these different programs just goes away. I mean, if you were an HR, benefits manager at your company, like, can you imagine having that tool at your fingertip? And literally, I mean, I think that would probably save me, maybe half of the time in the day, which, honestly, now more than ever, I think those leaders and professionals need that time back because we're getting lots of different programs, lots of different issues where that time is necessary to solve real issues.
I've had so many people call and they were like, Wally, this is going to cause, a reduction in jobs and AI is going to replace people. What the best consultants and plan sponsors and health plans are now using this technology not to replace anybody, but to replace the time we're spending doing administrative work. So now we can actually be more strategic. We can be a better advisor. We can be a better plan sponsor in how we're supporting our workforce. So I'm not of the camp that this is going to replace people. I think it's actually going to make us better and more effective in the jobs that we actually signed up for.
So, obviously, being able to digest information, create these incredibly, thoughtful and accurate responses is super powerful. But, that's just really just one way that AI could impact healthcare. Wally, what else are you seeing out there in the market that you're excited about from an AI, tool
Yeah, I
perspective?
mean, obviously, Scott, one area that I'm the most excited about is how we're going to be able to use AI to improve outcomes so that we can extend the quantity and quality of people's lives and ultimately connect patients with the best providers. And one solution we've been reviewing, we're actually having a digital human, if you will, reach out to doctors' offices, call multiple doctors' offices at the same time to find out which doctors are accepting new patients, have appointment availability so that we can immediately schedule appointments for patients in areas where we have, real challenges. Before this, a patient would have to go to a directory, hope the information in the directory is accurate, call around in their market, hopefully finding a provider that's accepting new patients. But now they can sort of delegate that off to a machine that can call multiple offices instantly. I think this is the closest thing we have now to a true open table for healthcare. Scott, in the work we led with the health plan, we would present high quality providers on the smartphone so that members could instantly see who the best providers are in their market. But ultimately, telling somebody who the best provider is only half the battle. Getting them connected to that provider so a real patient visit can happen, that's the part that's been missing.
Yeah, we've talked about this a lot historically, but if you think about the real purpose of health plans, it's not about services that they can provide. It's really about how do they make it easier for patients and providers to connect, to work together, to get the care they need, and ultimately, have a better quality of life, better health. And so, this is, although it seems administrative and process oriented, because it is so difficult to schedule and the industry is so fragmented, I honestly believe like this could be one of the most important innovations for just improving from both the provider perspective, just their ability to operate their practices and see patients, as well as the patient perspective, how to come closer together in a way where they can focus on treatment and actually get it feeling better.
Scott, two objections I hear when I talk to, leaders around the industry about, these types of technologies is, what are we going to do about confidentiality of our data? What about security and privacy? And then the second is, do I really want to be dealing with an AI bot? What would you say about security, privacy, and dealing with an AI bot?
I mean, from a security and a privacy standpoint, I think we're seeing that these AI engines have become very sophisticated on setting up their own private data lakes where you can put in information, and that information is is not only secure, but it can be personalized to you. Even the ability for AI to interact with other people is honestly better than what we get out of our, basically the people, the actual humans that have been doing that historically. From an administrative process standpoint, like I think the experience improves dramatically with AI.
Yeah, the phone call that we're going to make available to our listeners, when I first heard the AI phone call, I didn't believe it wasn't a human being. There's no way. And one of the most challenging
No way.
calls that if I were the patient talking, trying to get an appointment, I would have hung up on that, call because it was just too hard. So again, I think
Too hard.
we're really on the cusp of seeing changes that are going to be good for our industry, good for employers, plan sponsors, the plans themselves, and most importantly, the patients that we're all here to serve. Ultimately, I think providers are going to rally around this type of a technology, so it makes their world easier as well.
Yeah, they'll have their own AI agents on the other side, and it'll really be agent to agent. And honestly, like I think that would be a great
Yeah.
outcome.
So, Scott, when you think about these technologies, who's this best for? What type of organizations is this the best fit for?
Yeah, we all need to be, in my opinion, leaning into these type of technologies just as quickly as we possibly can. Cost is still out of control in healthcare. Administrative expenses, and that just administrative burden. I mean, I think we have estimates that in excess of 30% of that cost is tied up, just in those inefficiencies. And so, where you get that technology will probably vary. I do think that for a lot of these core technologies, it is incumbent on a lot of our health plan leaders to embed these technologies into their core health plan. But honestly, if you're a provider, if you're an employer, if you're a consultant, you all need to be looking for ways to take advantage of these new capabilities.
And Scott, things are moving so fast right now, and I see two different kinds of organizations evaluating AI. There are some that are just like, we're not going to wait around, we're leaning in today. And I see them having major advantages from the early adoption that they've taken on with these types of tools. And I have other organizations that are, hey, we're going to evaluate this for a long time, and we're hesitant to make a decision, because we're just not sure what is what. Those who are going to get probably left behind are the ones that don't do something, so that I think the call to action is to lean in and not to delay any longer. Hey, Scott, thanks for your insight today. Hey, and for our listeners, thanks for being here. If you'd like to learn more, reach out to us at Swift Health. And for now, stay cool and stay swift.